I'm Dr. Brent Boyse. I'm an oral and maxillofacial surgeon, and I practice in Mesa, Arizona. My favorite topic to lecture on, that's a hard decision. I think there's two favorites of mine. One is business skills. I love helping other surgeons grow their practice and experience or achieve success and joy. And so that brings me a lot of satisfaction. My favorite surgery to do, which I also enjoy teaching, is full arch hybrid surgery. Well, I think the business skills aspect of dentistry is important. In the past, historically, I think you could be a mediocre business owner and not pay attention to many details between the reimbursement rates and the ability for patients to access care. It was easy to be profitable and be successful. I think today's market has changed. I think families are feeling it more. Everything is more expensive. I think this disposable or household income dedicated to healthcare costs is less than it was. I think treatment is more expensive. And then as a business owner, our supplies have gone up, our costs for our employees have gone up, our reimbursements from insurance companies have gone down. And so I think the margins in dentistry have tightened significantly. And if you don't run a good practice, if you're not watching the numbers, if you don't know what numbers to look at, if you don't have a competitive advantage, whether that's an excellent customer experience, which I think is of utmost importance, or you're not organized, or if you're a specialty practice and you're not communicating well, I think it's hard. It's hard to survive. It's hard to be successful. I think that's why many practices have sold or combined or consolidated into larger organizations for support in those parts of their businesses. But for me, my passion is to have a thriving, privately owned practice with my partners and help as many people as we can and have a happy, great career along the way. I think the next step of innovation in oral surgery and really any business is going to be adaptation of the technology through AI, who knows, maybe robotics, making us more efficient, making a better patient experience, and being able, because of these efficiencies and attracting more patients, being able to help more people. I think the best way to learn is in-person learning. When you can kind of unplug from life and sit in a meeting, in a course, and learn firsthand from a quality educator, for me, that face-to-face interaction is always best. Not only from the educator, but also from the other participants. You get to meet other professionals who may be already doing these things and they're at a different level than you. And I think the camaraderie, the conversation, the questions that are asked is just much more powerful, or the most powerful way to learn. I think hands-on also is great. I think over-the-shoulder and live courses are great too. And I think that's the most effective.